All right. I guess we are now. Make sure the recorder's recording. Yes, it is. Okay, so tonight on the region. Look at that. I'm already screwed up. The Legion of Reason diversion. Michael Kruse joins Chris, Twyla, and yours truly, the Supreme Irreverend Dr. Randy Tyson. Michael is executive director of Bad Science Watch. The mission of Bad Science Watch is to quote, provide analysis of dubious scientific claims to Canadians, our government, and the media, promote objective critical thinking, and advocate for the enforcement and strengthening of consumer protection regulation. They've been at the forefront of the fight against recognizing homeopathic vaccines, better or infamously known as no-sodes, and the claims that Wi-Fi can affect public health. Welcome, Michael.
Hey, it's great to be here. Thanks, guys.
Yeah, it's good to have you on. Now, let's just get some public service messages out of the way. You're going to be in Calgary on February the 4th at Mount Royal University speaking. What's the topic of your lecture?
Yeah, I'm going to be coming out and talking about empathy and science advocacy, trying to combine, emotional responses to information with rational responses, or what people think are rational responses. So, yeah, I'm excited to talk about it. It's I got invited out by CFI Calgary to come and address, in a public forum, the kind of questions we have about how to properly go about, or not how properly, how most effectively to go about science advocacy. So I'll be using empathy as one way into that, and hopefully we'll have a really interesting conversation.
Yeah, so what do you mean by combining empathy and, well, I guess scientific advocacy?
Yeah, it's interesting. When we started Bad Science Watch in 2012, we went through a sort of a huge, it was kind of branding exercise. But any kind of new organization probably should go through this to sort of develop our mission, our values, and everything else. And one of the things that we really wanted to do, first of all, we were very focused on being an effective organization. So rather than just doing education, which really, if anyone's ever done this kind of in a public way, it's really hard to gauge how effective you're being. It's almost impossible. I mean, unless you're really focused on a specific goal, it's hard to sort of to find out if you're actually convincing people to change their minds. So we decided to not abandon that, but make that really kind of a secondary goal and focus on how to make change for Canadians in society. And that means that we have to pick targets. We have to actually decide who are the most effective kind of levers to push on and pull on in society to make change. And one way to do that, I'm going to argue on Saturday, is to sort of take an empathic approach to sort of identify what people are going to be receptive to the argument and what the basis of their disagreement is. I think that we don't talk about values enough in the science advocacy community. We kind of accept, because we all value objective truth, that there is an objectivity about the world, and that our feelings about the world don't really matter, that the world is the way it is, and science is a way to understand it. But in reality, when we're dealing with the public and we're dealing with politics, values is what it's all about. What we hold to be important. And myself, I value objectivity. I don't think that it's possible to be completely objective. We all have inherent biases of being humans. And but it's an important goal to strive towards. And science certainly is set up to be kind of an iterative process by which to approach objective truth. So I think that's valuable. But there are people who don't value that. There are people who think that knowledge about the world comes through intuition, or comes through some other kind of magical thinking, or maybe through religion. And you're not going to convince somebody who believes that intuition is a way to knowledge by hammering them with the scientific method. I think that over and over again, we've learned this lesson that, just because you have the facts right doesn't mean you're going to convince people. And so at Bad Science Watch, we decided to take a different approach and focus on the people who were responsible for being rational, or responsible for accepting evidence and approaching things in a manner that didn't just rely on emotions. And so we focused on the government primarily. I think we've all had the kind of experience of going home for a family holiday and getting into a fight with, Aunt Sadie or Uncle Bob about creationism or the value of vitamins or, that chiropractic appointment you had last week. And I don't think that anybody has had the experience where they've managed to convince, their family member that they're actually wrong and that they should adopt your position. And given that, I think that it's kind of a futile effort to sort of approach consumers and people who are the end users of these kind of products and try to convince them, because there's a lot of different reasons why. I mean, the backfire effect and a lot of psychological reasons. But ultimately, if you convince one person and one consumer to change their mind, it doesn't really have a great effect. What we should be doing instead is focusing on the people who are influencers of consumers, and this means the government. It means organizations that are set up to regulate alternative medicine practitioners and municipal governments who make decisions about fluoride and other kind of important science advocacy topics. And so, understanding the emotional stake that everyone has in this, I think, is a vital part of being effective.
Well, along with that emotional state, why is it easier to convince and dupe people than it is to convince them that they're being duped and that they're going to get, cavities? They're going, why can't we do the same thing, saying these people are selling you something and you're going to get cavities? They are tricking you, but I guess those are all the wrong words. It's you're buying this into this so that the outcome isn't healthy and you're going to get sick. I don't understand how we can't use similar words that they use to point out the fact that the emotional part is that people are getting hurt, and that's my emotional side. That's why I fight against the fraud. Why can't we convince with emotion the same way?
Yeah, that's a great question, and certainly that's certainly my approach when you're confronted by an individual, like when I'm dealing with my family or my friends about these issues. You have to sort of, you have to stand up and speak truth to power. But I think that the effectiveness of that is what I'm questioning. I'm not saying that, standing up for those beliefs and arguing that certain things like taking fluoride out of the water system is harmful. I'm saying that I'm not sure it's very effective.
Yeah. What is effective?
Yeah, well, exactly.
You can't tell people you're going to get hurt. What do you tell them?
Yeah, exactly. Well, this is the thing. So I don't think that we should, my tactic or our tactic at Bad Science Watch generally is to not have that conversation. Mm-hmm. We approach the people who should have, who approach it on a rational level. So, for example, in the case of no-sodes, the government, the Health Canada and the National Health Products Directorate, which is now called the Non-Prescription and Natural Health Products Directorate, when they were approving homeopathic no-sodes as part of all the rest of the natural health products, they were really just hearing messages from manufacturers and interested consumer groups like the Canadian Health Food Association and the sellers of these products, basically. And they were able to convince, because of this kind of siege mentality, this kind of when you own a health food store chain, you've got kind of a built-in constituency that you can have, individual one-on-one conversations about. They're going to take away your herbs and they're going to take away your vitamins. So you better sign this compact that says we're going to fight on your behalf. But the government is a rational body for the most part. I mean, obviously they take their values from the minister who runs it, but they have the opportunity to step back and go, no, wait a second. When we're making these decisions, we can use a variety of tools to come to a conclusion. And one of those tools is science. One of those tools is community values. One of those tools is kind of pressure from constituents, from the politicians. And so we have an opportunity to convince them that there is a public health threat. And they take that seriously. In the case of no-sodes, I don't think that they understood that there was a problem, or they didn't feel like the problem was important enough to act on. Until we made it a public issue and applied that kind of pressure. Why it doesn't work on an individual level? I mean, there's a lot of psychological and neurological evidence to show that that people, I mean, the backfire effect is essential, right? Back in 2010, I'm just going to grab this guy's name because I've not memorized it. Researchers out of Dartmouth College, Brian Nehan, I believe his name was, identified this kind of psychological phenomenon where people had already made up their minds about a subject, the minute you introduced contrary, well, what we would call compelling evidence that would say that their views are wrong, they in fact re-entrenched themselves in the original wrong idea, which is odd, right?
Well, doesn't that make the government the bad guy then, if they're going to say, hey, no-sodes, we've shown they don't work?
I'm okay with the government being the bad guy as long as no-sodes aren't available, or at least, I mean, in this case, they were labeled differently. And I'm not sure, like, the one thing we can't control is how the end user uses it. But, if your homeopath says to somebody who's hesitant about vaccines, you know what, don't worry, take these no-sodes, it'll prevent your child's measles, and you go and you buy the no-sode from the health food store, and on the label says, warning, this is not to be used as an alternative to vaccinations because there's no evidence it works, then you're going to have a moment of second thought.
Or they're just going to say, hey, they just stuck that on there because they're being jerks and they want to sell their vaccines.
Sure. But the more social pressure we put on people to think about these decisions, I think we can have a change. Now, I'd like to see no-sodes pulled from the market. Unfortunately, due to the way that regulations work and the fact that it's been approved in the past, it's a very difficult task, I've been told, to actually get these things off the market unless there's a demonstrable direct harm, like there's poison in the actual medicine.
Kind of like the teething gel.
Like the teething gel, yeah, exactly. Like the teething gel that came out again for the third time in 10 years that, there's actual poison in it.
Yeah.
I have a question. Is there a time when public outrage can be leveraged? Like, for example, what was it, the Colette? Maybe I'm getting their name. Colette?
Stefan.
Yeah. Sorry. Yeah. And also that woman who, whose child was diabetic, who neglected him. Is there a time to leverage that kind of public outrage?
Yeah,
the one here in Calgary.
Yeah, I totally agree. I mean, I'm going to be using the Stevens, the family as an example on Saturday, as a model, really. And models aren't perfect. There's a whole lot of, the True Hope backstory of that is really, really disappointing. And frustrating.
Yeah.
Yeah. But it's a good model to sort of start from. And I agree with you. I think that, we're not going to convince the Stevens. I mean, and we've seen David Stevens or Steffens, even after he was sentenced, say he did nothing wrong. Right?
That's a prime example of what you're saying about people doubling down when they're told they're wrong, kind of thing, right?
And we're not going to convince him that he's done something wrong. I mean, even in the case that his child died, like, you'd think that goes to the power of this kind of ability to convince ourselves, this motivated reasoning that we use to convince ourselves that we're right. Like, his actions directly affected the death of his child. Now, he may have convinced himself that it was out of his hands. But
or blame toxins in the environment, or
sure,
there's something else to blame other than his own actions.
Absolutely. But we can certainly leverage that to our advantage when we actually target the people who are responsible for this. So, for example, I don't think going after the Stevens for this, like the courts have dealt with this. We may not agree that you may disagree or not agree that the punishment is reflective of the crime. And that really, I have no idea if it's appropriate or not. I'm not a lawyer, but we can go after the people that were giving the Stevens advice, or
themselves.
I know.
Sell True Hope.
This is the problem. Yeah, no, exactly. And like using it as
and
a model.
They were invited to a conference to speak, and I think there was some public outrage that got them barred. Yeah,
absolutely. No, you're right. Like taking it, like I'm going to use them. I'm using it as a model without sort of acknowledging, at least at first, this other True Hope problem. When we approach, so if the Stevens were an isolated family, then we're looking at the naturopath. We're looking at the products that they were using. They used the True Hope products that are approved for sale in Canada. They used a couple other products that have NPN numbers. and the advice they were getting from professionals, not to mention their own family, is demonstrably wrong. So why is the naturopath who was advising, first of all, from all accounts, the naturopath was diagnosing the child over the phone, which is unethical. Like you have to do a physical exam and see the child. And I imagine if they had brought this sick, meningitis child to this naturopath, I would hope that they would have looked at the child and went, oh my goodness, this child is very sick. I can't take care of this child. We have to call 911 or go to the hospital.
Well,
I would hope
Stefan's even fooled themselves about how sick he was. They were in absolute denial, and they probably didn't even tell her half the symptoms, like he was stiff as a board.
Yeah, exactly.
Not that I'm trying to defend her, but these people, when the people that did see him, they advised the Stefans to take him to the hospital. They still did not. So even if the naturopath had advised them, they still would not have done it.
Yeah, absolutely.
Yeah,
the difficulty
can't always, convince everybody all the time. These people have not just a financial investment. They sell this kind of stuff, but they have an emotional investment in it. They put basically everything they have behind it. It's going to be
including
very
their
difficult
kid
to get these people to recognize that when there's such an investment in it.
Mm-hmm.
Yep.
Yeah, and I understand that frustration. Like I'm equally frustrated and angry at them for their choices. My greater point, though, I think, is that even though that kind of anger certainly is warranted, right? I think that they did something wrong and they were arrested for it and convicted of it, of neglect, failing to provide the necessities of life. I think the larger point is, if we're going to prevent this from happening in the future, picking people out like the Stevens, let's just take them without the True Hope connection for example. For example, let's talk about the other mom who who treated their child for diabetes, and or even the people we had a couple, an Indigenous couple in Hamilton. Now this is a whole other kind of can of worms because of the colonialist, legacy that we're trying to freaking deal with, but. People who chose, in the face of what was an obvious treatment for a curable disease, to eschew that treatment and to choose something else.
That was chemo, correct?
That was chemo, yeah. I think the child had leukemia, and I think the cure rate for the leukemia that the child had was about 90%.
Yeah.
But they decided to go to a natural health practitioner down in Florida.
Who pandered.
I think we talked about that in our podcast at the time. I was very upset about that. That was really upsetting. Yeah.
Well, and that particular clinic panders to the natives. So they use the prayer and the wheatgrass and everything else to draw them and their money.
Panders, I don't think is quite the right word. Exploits. Targets.
Yeah. Sure.
Yeah.
Thank you.
Yeah.
But again, I think that to prevent this in the future, I think that calling these people out for being bad parents, though they may be. I mean, who knows?
They're duped. They're so duped. They're so invested.
Yeah. Well, they're victims themselves. My point is that if we're going to convince other people to make different decisions in the future, I don't think that it's very effective tactic to call people even to victimize, even to call them victims, because people don't want to feel like victims. And I think that to get into that debate, no matter how in some cases righteous it makes us feel, or in other cases in that kind of not Schadenfreude, because I don't want people to think that we're taking pleasure in these people's suffering.
Oh gosh,
but
no.
How many times have you saying, well, that's what you get for making that decision?
I think signaling is what you're looking for.
Yes, exactly.
At the point and the thing is, you can be mad at the parents, but what's that going to solve?
Exactly. So my point is that, I think it's a better technique for our organization to sort of find out what the underlying values that these people hold are, and try to find the ones that we share in common, and then use that as a communication strategy to focus on the people we think are really causing the problem, who are the professionals who are registered with the government, who are self-regulated in their own colleges, and or empowered by the approval of these kind of bogus medicines by Health Canada to operate. And so if we restrict if something's pulled off the market because it's labeled as dangerous or ineffective, I think that sends a strong message to the people we can reach. And there are going to be people who are going to believe in this stuff, and there are going to be people who think there's a grand conspiracy by the government to take all their supplements away, fueled by people like the Canadian Health Food Association. I'm not sure if you've seen their rhetoric around the recent change in, the health regulations, but they're basically telling people, resist these changes, or else the government of Canada is going to come to your store and take all these things off the shelves. That's just not what's happening, right?
Well, and it was the same thing that how people got behind Bill C-51. All the government wanted was permission to go on private land to seize things that shouldn't be sold. So they turned that into the whole, they're coming to get all your natural health products. Yeah. And that wasn't even it, but they convinced everybody to rally.
Twyla, could you tell people what Bill C-51 is?
That's basically what it was. It was a law that they wanted to be able to go on private land and seize things that are being sold dubiously with dubious claims. They've already been charged. So they wanted to be able to go seize the products even though they're on private land. That was the law. Now, the people against the law, the people that want to sell these dubious products, told everybody in Canada using fax and email and everything at the time that they possibly could, come out and protest this. It's going to take exactly what Michael was saying. They're going to take away your stuff.
I just want to interrupt and make it clear that when you said the word fax, it was F-A-X and not F-A-C-T-S.
Yeah, fax. They were actually faxed. They faxed health food stores this whole propaganda piece about how you got to fight this.
Who uses fax these days anyway?
It was about 10 years ago.
Yeah, okay.
It was about 10 years ago, so.
You can fax through email.
You can still. I hate getting faxes because, when people email things, you just save it to your electronic file. Now you got to scan the fax into your computer.
Well, apparently it's more secure. That's why government still uses fax.
Sure.
It's ridiculous.
Until CIBC faxes their client information to,
exactly.
Automotive.
I've gotten faxes from at my government fax where I work from doctor's offices. Whoops, here's a patient note.
Yeah.
Oops. So now everybody's basically heard your talk and won't be there on Saturday. What is let's switch gears and talk about Bad Science Watch. Now, how did that start?
Right. So we, Jamie Williams and Carol Parlow, my co-founders at Bad Science Watch, back in 2011 identified that we need to have an organization nationally that was focused on, again, real change, that was going to, I guess, widen our audience from outside what was essentially the skeptical community. Like, we all came out of that community, and we realized that in a lot of ways we're preaching to the converted, and there was a real communications problem in that we needed to find tactics and approaches to making that were focused on making change rather than either educating or making us feel good, and that meant that we had to open it up to a wider community as well. Like, we figured that we had allies outside in the general science community, and as it turns out, with the focus that we've taken in the past couple of years with health regulations in the public health community and in the medical community in general, and by leveraging that kind of support, we could make some change at the governmental level. So we went through this whole process of, like I said, branding and figuring out our message, and wanted to sort of act as kind of a professional communications company in trying to bring about change with a focus on consumer protection, especially. Mm-hmm. So that's where we came from. We managed to generate a lot of interest with new volunteers, and our Stop No-Suits campaign attracted the interest of a lot of public health professionals. I wasn't quite aware. I mean, we had chosen Stop No-Suits as kind of low-hanging fruit. Like, this is the obvious problem with the regulation of natural health products. Like, why, if we can't change this, we can't change anything. And what was surprising to me was that the problem was so widespread, especially in the West, we had gotten, I'd spoken to a public health nurse out in Alberta who said that, in her community, public health nurses, every week there was somebody coming into the office to show they'd had their vaccinations up to date, and they brought in a note from their homeopath.
Oh.
And they had no idea how to kind of approach that. Because, again, you want these people to get vaccinated. You don't want to lose them in the system. And so you have to find a way to communicate with them that doesn't alienate them even further, because they're already at a disadvantage, or the public health nurse is already at a disadvantage when they're trying to communicate with someone who's made this decision, because now they've made the decision and they don't want to think that they've made the wrong decision about their, kid's health. So, facing that problem, it was a much bigger issue than we thought, especially since apparently the government had been hearing from the Alberta Public Health, from the British Columbia Centers for Disease Control, from other public health schools, that this was an issue, and they had basically ignored it, which I find incredible. Like when the lower tier kind of parties saying, "Hey, your decisions are kind of getting in the way of good public health, policy," you'd think they would take action, but they didn't. It took more of a public kind of campaign to get them to change their mind, at least somewhat. So that was the kind of effort we were focused on with Bad Science Watch.
Yeah.
So, yeah.
Just thinking here.
Well, just opening up communication, yeah. You were saying, Randy?
I was just thinking about, we're on the topic of vaccinations as a big hullabaloo within, especially in British Columbia, with frontline healthcare workers, with the whole vax or mask policy that's going on. And it is true that there's very little evidence that shows that you cannot, that you're not going to prevent flu or other transmission of other communicable viruses. And that's one argument, but there's an argument that I haven't heard, and that is what happens if all of your frontline healthcare workers get sick at the same time? It's an argument that has been totally ignored, and in a pandemic, that could be disastrous. I know I'm getting a little bit off topic here, but I was just thinking about that. We were talking about vaccines, and it kind of reminded me of what's going on in British Columbia right now.
Is that part of the pandemic action plans that they have if all the frontline workers get sick? Or
yes, it is. Yes, it is. I've done
isn't.
some documentation, and I can't really discuss it and that kind of thing. But yes, it is.
Yeah.
Yeah, it is in my organization. We certainly we're prepared. We're making preparations. I work as a paramedic full time, and we're out in the community getting exposed to this stuff. And our lessons from SARS kind of taught us that we have to pay attention. Otherwise, we're going to start losing healthcare providers, and not serving the community. In those kind of combinations.
They won't be in a condition to. They'll be occupying hospital beds on their own.
Yeah.
And this is something that just really bothers me, is that so many nurses, especially, will not vaccinate. It just kind of blows my mind.
Well, after I saw the nursing program, their alternative medicine, how you feel about it and how you incorporate it and yada yada, and kind of a semi-bashing of vaccines within the nursing program, I'm not surprised.
Yeah,
me either.
At MRU, my wife is in the nursing program there, and they're required to vaccinate. They don't have a choice. And
do they have that? It was Lethbridge that had that stuff in their curriculum. Where she's at, do they actually at least not do that?
Yeah,
I don't know what it is for other universities.
I think it might be a legislative thing as well. I know that there's entry to practice in the Act. I mean, well, at least with paramedics in the Act, you have to have you have to show.
In the Canada Health Act? Or
no. Sorry, in Ontario, it's provincial. Yeah, provincial. To enter into the profession, you have to have a certain number of vaccinations, and I know that there's a similar thing, but it's not quite as robust with nurses in Ontario, at least. I'm not sure about Alberta, but that's definitely provincial. That might be a provincial mandate.
Provincial, it'd be under their purview, and it's kind of when you have healthcare workers that don't buy into what is clear to us as scientific skeptics that vaccinations work, how do we expect the public at large to go against that?
Yeah, I agree. I know that one of our former advisors, Dr. Ken Milne, who's an emergency physician down in Huron County in southwestern Ontario, tackled this problem in his own hospital. He's in a community hospital, and I think they got up to 95% compliance rate with their vaccinations. And they basically took a communications approach to convince people to get it, and instead of the hammer of you will get this or you will wear a mask and we will embarrass you, because people don't respond to that very well.
No, they'll double down. We've already talked about the double down. That'll double down them.
Exactly. Paramedics said the same. We, when the flu vaccine, we have a public health unit in we have public health nurses in in the region where I work, and I have had discussions with some of them who went through when the original mandate came down to when the flu vax came out. They were convinced it was killing their clients.
Oh my.
I'm not sure how. They thought it was killing their clients, but there became this real opposition that they saw. They saw their clients getting sick, which they're prone to do in long-term care facilities. I mean, they're elderly and they're already compromised immunologically, right? And so everyone gets the flu vaccine, and then 20% of them get some other infection, and you think, oh my God, they got the flu vaccine. Like, it's just improper.
It's not correlation.
No.
They need to understand that something else made them sick. Like, I mean,
Yes, exactly.
This happens all the time, whether it's
They're
norovirus or
counting the hits and forgetting
RSV.
the misses.
Yeah.
Yeah, like,
Exactly.
ugh.
It's
And then
frustrating.
the
I know.
confirms the bias. Yeah,
Uh-huh.
it's
I always-
it is. It's very frustrating.
Yeah, I always figured as well that I think that it's important. Like, one tactic that I've taken, at least, is to be a model. Like model the behavior I want to see in other people, right? So when I get my flu vaccine every year, I tell everyone about it. Hey, I got my flu vax last week, and then
Me
when
too.
you confront people,
So
you
you're
find out that
witnessing.
I'm witnessing. I know. We got to take a
Testify.
lesson from the religious. I know it works, right?
I think I'm the only girl in the office that's an administrative assistant that actually gets the flu vaccine. So every year I tromp in there with my sore arm, and they all kind of look at me. Boy, there's no proclamation good for you, that's for sure.
Yeah, exactly. And if we can get thought leaders in those same communities to do the same thing, then more people are going to buy into it, right? And again, this is going back to my other talk. Like, if we use an empathic approach and identify values, we can identify the people who are the people who are resistant to these ideas. We can identify the people whom they trust, and then target those people. And that's a bit of, you may run into the same problem, right? Like, if you find a minister, for example, preaching creationism, and you target the minister, well, of course, their flock is going to go, wait a second, like that's offside as well. But I think if you can do the opposite and identify the people that people trust in their own circles and convince them, then you'll have a better chance of convincing the people in the wider community who trust those people. So. It's a bit, you could look at it as kind of a manipulation, but I think that it's the way that things happen anyways, randomly. So we better use that to our advantage and find a way to convince people that they should model the behavior they want to see in their reports.
We should be using the most effective techniques possible. That's the thinking person's approach.
Yeah, and I would use the word persuasion rather than manipulation.
Yes, exactly. Yes, yeah, exactly.
Rhetoric, right? Yeah.
Potato.
One's nicer. See, I'm persuading you to adopt, persuasive language rather than manipulative language, even though it's the same bloody thing, right?
Yeah.
Yeah.
Absolutely.
Yes, it's just a different framing.
Yeah.
Yeah. So, what has Bad Science Watch been up to lately in terms of their pet peeves, I guess you could call it?
So I'll go through the past year has been a bit tumultuous for us. We coming out of we did we fought against the changes in not fought against. Sorry, we were advocating for specific changes in Vanessa's law a couple years ago That was the sort of inheritance of Bill C-51, in which the NHP community won again because they got a specific exemption in the law for natural health products, which meant that natural health products remained the only product in Canada that the government cannot force a mandatory recall on. You can recall cars and coats and apples and Tylenol, but you cannot comply. And this is the problem with the teething, solution, right? So we've got this problem, but they argued, and I think that finally the government has, and the bureaucracy's kind of thrown up its hands and went, okay, we're just going to call bullshit. This is ridiculous. Like, you cannot tell us that there's not an inherent problem in a product that has poor quality control. You cannot tell us that, something is inherently safe. Nothing is inherently safe. Everything has risks and benefits. Water has risks and benefits. You drink too much of it and you will die. So, or you can drown in it, for example. So, these, I think they finally been pushed to the edge. But during Vanessa's law, they got to the politicians and they convinced them that natural health products are inherently safe and therefore they do not need to be in this law. So coming out of that, we went, well, what's our next tactic? Now we had done a couple. We worked with CBC, Fifth Estate, a year ago, and on the documentary on supplements, which basically told the story we've been telling since we started in 2012. We happened to, it's funny how things sort of happen all together. When we started in 2012, the Health Canada came out with a new pathway to licensing for all their natural health products. And I went to one of the road shows to sort of see what their tactic was. And it was eye-opening, let me tell you, to take a risk-based approach to approval of these products instead of a cost-benefit or a risk-benefit. And it was, so we crafted a story and we told everyone we knew, and we finally got it told on mainstream media last fall. And so, unfortunately, we're all volunteers at Bad Science Watch. I've got a full-time job, and I also go to school part-time, and I've got other things that I'm doing. And Bad Science Watch became, it really just burned me out. It burned Jamie Williams out. He had to step back as the executive director, and I took over in the interim, and then it burned me out. And so last fall, we took a little hiatus to take a break, and I thought, maybe we won't be back. Maybe we just can't do this in this current client, or maybe we don't have the kind of resources to go up against these other organizations, certainly not as a volunteer organization. And we came to the conclusion that really wasn't, there were still things we could do in a moderate way to affect change. And we still had some stuff into us. So we came back in April of 2016, and we decided to have two projects. One that was very successful was the NNHPD Consultation Committee. So the Natural Health Products Directorate puts out public consultations on monographs, and monographs are basically pre-approval documents. So if you have a single ingredient product as a supplement and you want to get it to market, if you follow all the rules in the monograph, you can have approval for your product in as little as 10 days, which is incredible.
And no
to get
efficacy necessary to show efficacy.
Not at all. It's all risk. The claim, the amount of evidence you have to show is based on the risk of the claim, right? So if you make a general health claim or a traditional health claim, you have to provide basically no evidence, or very, very expert opinion. You find a naturopath to say, yes, this herb works for X, then you're good.
Really?
So
Unbelievable.
It's unbelievable. I know, and they realize there's a problem with this, and the problem is that they haven't heard from anybody but the producers in the past 20 years. The medical community, the mainstream pharmaceutical community owns all these companies, many of them, many of the larger ones, the supplement manufacturers. So they're not going to speak out against it. And
what about pharmacist organizations?
They were making money off of. They're making money off of these things. They're not going to speak out against them either, right?
Well, yeah, and that's the biggest irony of all this. They're like, oh, the big pharma, they're against these things. They're the ones selling
they're the ones
them.
Producing them, yeah.
And selling them. It is the biggest irony, and I don't know whether to laugh or cry.
Well, the other problem, of course, is that the the rhetoric they use to sell these things are, well, these are, for example, quality control, I think, is a huge issue. We have identified many studies now that have shown that the quality control of natural health products is crap. And in fact, under the law, there is no requirement that you have a quality control program in place for natural health products.
What's one big example of that you can tell us?
Oh, well, there was the Guelph, the Newmaster study out of Guelph found, okay, I'm gonna be approximate on these percentages, but at least they took a random sample of products off the shelf, which they would not release the names of, I think because of a liability issue, because there was a producer in the U.S. that just got sued, a researcher in the U.S. just got sued for calling out one of these companies because they found operations. So they didn't release the names, but they did forward them on to Health Canada, who promptly did nothing that we know of. But they found that half of all the products they surveyed, they did what's called DNA barcoding. So they basically put the herbs through a process by which they could identify exactly what's in it by the DNA barcodes. And a process that's not the industry standard, but it certainly is very useful to answer the question of, are these products what they say they are? And they found that half of them had adulterations. 3/4 of them had products in them that weren't on the label. And they had replacements. They found that a large percentage, a third to 2/3 maybe, maybe a third, I should say, had nothing of the labeled ingredient in them. They had a complete substitution.
That's what they found in the past without DNA barcoding.
Yes,
so
exactly. It's not
no
a surprise. I know, and so this is the kind of problem, and we've seen adulterations. Every week I get something in my inbox saying someone's put Viagra in this natural sex product, or someone's put cholesterol-lowering medication in this other heart product, and this is kind of, and Health Canada is playing whack-a-mole with these things to try and get them off the shelves.
And they're also complaint-driven. That's how you they don't actively go out and test these things. It's a completely complaint-driven thing.
Yeah,
so
but they've got limited resources. They shut a bunch of labs down and downsized in the early 2000s. One of our advisors was one of the people who was downsized, Dr. Brian Foster, and so they don't have the resources to go after these things. So what we've done, we're not only are we telling that there's a problem and telling the story, but we're also looking at the marketing of these products because the licenses. The individual manufacturers are, I think, pretty good. They have to be in compliance with their license as far as labeling goes. You can argue about what the decision by Health Canada was to put on the label, but most of them are compliant, I think, with the labeling. The problem is once they get onto a distributor's shelf or retailer's shelf, then the retailer can basically do whatever they want because there's now there are close to 100,000 products since the amalgamation of cosmetics, non-prescription, and natural health products in the NNHPD database. Before this amalgamation, there were upwards of 60,000 products of non-prescription and natural health products. Most stores contain 15,000 SKUs, stock keeping units, right? So nobody can possibly stock 60,000 different products. We found about 30,000, I think, that use the word traditional in their license. So it's impossible to go after these retailers who are making basically any claim they want about these products. And our suspicion is that people are thwarting the license and promoting these products as cures or treatment for restricted diseases. Under the Food and Drug Act, there is an appendix, Schedule C, I think it's Schedule C, that lists all the health conditions that you cannot market cures or treatment for, like heart disease and alcoholism and stroke and cancer, all the kind of big ones, right? And now you could market, again, under the law, you can market things to prevent those products, those health problems, which again is a problem because there's no evidence that they prevent it. But you can't market a cure or treatment. So what we're doing with the natural health product marketing project is we're taking a survey of online retailers in Canada. We've got about 177 people websites identified. We're going to go through and through keyword searches using the Schedule C or Schedule A. Excuse me, it's Schedule A. We're going to identify keywords for, like, for example, cancer. We're doing a pilot project to get it all underway right now. We're using cancer and its analogs to identify these products to see if retailers are actually marketing these products directly. We don't have any data yet. I'm not sure if they're going to be in compliant or not. I suspect that given the problem we've had with flu no-sodes, that they're not going to be compliant. We already did a small project about a year and a half ago that identified 15 online sources in Canada, pretty mainstream as far as those things go, sellers of flu no-sodes, of the influenzanim, who were marketing against the license. And we sent those to the Marketed Health Products Directorate, which is the inspectorate at Health Canada, the people who enforce the law, and they managed to get them to change their websites to be compliant with the actual original manufacturer's paperwork and the license under Health Canada. So that small kind of victory led into this larger project. We're asking the question, are people compliant? And we're certainly looking for volunteers to help evaluate. We have a lot of data, upwards of 178 gigs of these websites that we have to go sort of scrape through and search and evaluate. It's going to take a little bit of time, but I think it's going to be worthwhile because we're going to try and answer this question about whether, these retailers are actually upholding the law, or whether, like we suspect, they're hiding in obscurity and getting away with selling people bogus crap.
And that's what I wanted to bring up is if people wanted to become involved with Bad Science Watch, you're looking for volunteers for data analysis, for instance?
Absolutely. We could use at least, 10 or 15 people extra now to do data analysis for this project. We're evaluating, or we're establishing kind of a protocol and a training program. And you would basically go through about a 1-hour training to access the data and use our tool, and then you would call up one of these websites and evaluate it given the keywords found in it. And it's something you can do much like citizen science projects. It's something you can come to and leave. You don't have to commit to a certain number of hours a week. You can sort of work on it as much as you can, and until we get finished. And so we're looking for volunteers for that. Certainly, that's our greatest need, I think, right now. Other than, of course, fundraising professionals who want to help us, because as volunteers and as grassroots activists, fundraising is the weakest part of any kind of organization like this. But yeah, if you want to get a hold of us, they can send an email to our volunteer coordinator at volunteer.coordinator@badsciencewatch.ca, or find us through the website or Facebook or Twitter, and we'd certainly get back to you. Because we could certainly use your expertise. And it doesn't, while we have a lot of people who are, we've got some epidemiologists who work for us or volunteer for us. We've got other scientists and people who have done this kind of research in the past. You don't have to have a science background to participate in this. We're gonna provide you the training we need to sort of get everyone to a minimum standard. And getting involved with this, I think, gives people an outlet, right? Like when you're sitting there thinking, what can I do? When you get frustrated with these things like the Stevens case in Alberta, and it's kind of overwhelming, and everyone feels like one person. What can one person do? When we do this kind of work, we found that if we get together in a collective way and talk back to Health Canada, they will listen to us. So send us an email and let us know if you want to volunteer.
Oh, that's good. Any questions, guys? I've talked.
That's a pretty thorough interview. I live by a Shoppers Drug Mart, and I'm wondering if you're looking at like health food specifically, health food stores, or whatever supplement stores specifically, or if you're looking at some of the big chains and what they're marketing, because I know that Shoppers Drug Marts are independently owned, and they've just got the one I live by has just got a bunch of bullshit. Yeah. A bunch of homeopathic remedies and stuff like that. And I'm just like, oh, why are they doing this?
Because they make money.
Well, yeah.
There is I feel, I've been talking to some volunteers who work in that industry, who work in the pharmaceutical industry, and they're telling me that there is starting to be some movement, especially in homeopathy. They all remember when the cigarettes were pulled out of pharmacies. That took a legal order, right? That took a law change. But from what I remember, it was a while ago. But they were resistant to that, but understood that philosophically it didn't make any sense for a pharmacy to sell cigarettes. And I think that they're slowly coming around to that kind of point on homeopathy. Now, vitamins, like, forget it. That's a huge market for them. We are basically, what I did to get the data set that we've got. It was collected because we're doing a pilot study right now. It really is about the design of the study. It's not necessarily about the current state of the data. Our data set, we collected it last fall, was based on a list of websites that we pulled from a couple different databases online. I'm not going to tell you where they are in case they don't let us access them in the future, because they're meant for consumers. But we basically targeted people who were selling stuff online. And now, Shoppers Drug Mart may have an online store, but I don't think that they do anymore. I think they want you to come into the store. So that's the kind of limitation. I'm
just wondering if there might be some pressure to put, like, hey, if you're going to be a Shoppers Drug Mart as a corporation kind of thing, might have to, put out the order, hey, if you're going to sell this crap, you can't be associated with our brand name. You can't hold this brand name, right?
Hey, Chris, yes. I had an idea. What you can tell the consumers is, if you're buying the big pharma homeopathy, only big pharma is getting the money, and then that'll get scores of people away from giving big pharma money, right?
Yeah, but people are too lazy to read the labels. They see the sub brand of a huge corporation and think, oh, it's
that little yeah.
Yeah, I mean, marketing
legitimize it,
right?
Too. Yeah. So then they think it really is medicine, and because not everybody bashes big pharma. Some actually still like big pharma. So
it has its problems too.
Well, it's always disappointing to us. Like, we're not a defense. We don't go out and defend big pharma. They can defend themselves. They've got enough money and power. We're not going to add to that. Banks and we've certainly, exactly. We've certainly called them out on things like we're signatory to the All Trials campaign out of the UK, where they want people to actually not people, but the pharmaceutical corporations to publish their clinical data on the clinical data books, so people, researchers especially, can evaluate them in a third-party way to see if the data they've covered actually matches the claims on the label. And so they've got their own problems when it comes to this kind of trade secrets issue, because we really have to, in order for us to trust them, we kind of have to trust the FDA or Health Canada or the European Drug Agency. Whatever, that's probably not the right name, but there's a European Commission that does that kind of research as well, or approval as well. And so we have to sort of trust them to do the job for us. And of course, the way that power works is those with the money have the access. And if we can't get access to the FDA, then, they may be convinced when we wouldn't to sell these products. So we want to have the pharmaceutical companies release this data into a database. It's certainly happening. In Canada, has not quite happened yet, but there's not a lot of primary drug research that happens up here. It happens down in the U.S. mostly.
Yeah.
I have another question. Do you think that the government under Trudeau, as opposed to Harper, is friendlier to your messaging?
Oh, yeah.
Yeah.
Yeah. You know what? It's funny. The changes that we wrought with no-sodes actually occurred under Harper. And Rona Ambrose was the health minister at that time. Because it was a regulatory issue, it wasn't a legislative issue. Like the regulator, the bureaucrats, while the people in charge of these organizations, the directors general and the managers, certainly they have to respond to their political masters and move when they move. But if they're making decisions on how to interpret the regulations, there we can have a real change. And I think it's telling that even under the Harper regime, who was very pro free market, like they didn't want restrictions on these products, and despite that, they made these changes, and they realized that they've got a huge problem. Now, I am more optimistic under the Trudeau government that they're committed to open government. The last couple of years, the Canadian Science Policy Conference has been a big focus on evidence-based decision making for public policy. Now, it's a big, what's that called, buzzword. So lots of people like to use it, and really it makes a difference in how they apply it. But certainly after this year's Canadian Science Policy Conference that I went to in the fall, it looks like they are fully committed. Now they have to convince people to change, because under the Harper government, we've spoken to people who work in departments, especially in climate change or environmental, where their managers are still really afraid to move. And it's going to take shuffling of the leadership in those departments to really make the change complete. Because they're still working under you do it for long enough and it just becomes automatic. Oh, that paper is not going to fly. I'm going to put that in a drawer or refer it to council and not act on it or send it to my minister until we've done that, because it's just not.
They're not still under orders to pass everything through.
I don't know. I don't know. Well, you're still responsible to your senior management, right? But officially, they're supposed to be open. The problem is that there's still inertia within the bureaucracy, because they're still working. They're still sort of getting over the even a year later, they're getting over the Harper hangover.
Yeah. So shell shock hasn't gone away.
Yeah, exactly. But I think I'm optimistic that things are changing. And while we don't deal with a lot of departments directly, Health Canada really is the only ones we deal with with our current projects. It sounds like everyone is very focused on using science as a way to inform policy. Now, of course, that depends on the question government asks, because government just doesn't go, hey, what should we do? Let's look at the literature and see what we should do. Oh, the literature says this, so let's do that. They don't. They ask a specific question, right? They say, if we did this, what would happen? And then their scientists go out and they answer that question for them. And if they don't ask the right question, they're not going to get the right evidence. And I think it was clear that there's still a roadblock if a third party. Again, I'm kind of talking through my hat on this one, because I'm not a researcher. But my understanding was that if a third party, like an academic researcher, made a discovery about, I don't know, sea lice. That's kind of a BC coast thing in like salmon fisheries. That I'm not sure if they made a discovery that went against current government policy, if the government would listen to it, because they have not interested. They may not be interested in changing that policy right now, because of all the parties involved: the fisheries and the fishers and the industry and the regulator and the province. Like, there might be a difficult thing so they might just ignore that evidence. But I think that they're committed to actually, having an evidence-based approach. So I'm optimistic that things are changing. I know that may be a bit naive. I'm an optimist generally, and I may be disappointed, but
I'm wondering if under Trump, with the Trump, if that's going to light a fire under Canadian asses to be a little bit more on the center stage of, promoting scientific and evidence-based policy.
Yeah, it certainly is an opportunity. That's for sure.
Does it kind of matter when it depends on if it's a federal issue or provincial issue, and then it depends on the government within the province, and then the people in the department. It's quite, there's so many layers. And then if they don't understand, like if it's not communicated to them why it's important, it's almost like you almost have to threaten them with some kind of, we're going to the media with this then, and this is, can they even do that?
Yeah, so here's our tactic on Stop No-Sodes. We took 3 kind of tactics. One was we made a solid argument, so we had the evidence, and then we communicated with Health Canada. Now, we don't have access at Health Canada like other consumer groups do or industry groups do. Frankly, I'm a paramedic. I was in theater. I'm not a political operative. We're getting some advice on that through an organization called the Canadian Advocacy Network out of Ottawa.
Good.
Which is great, but we weren't quite sure where to go. Right? Well, I'll just send an email to X, or I'll ask for a meeting with Y, and we'll see what happens.
Or get in on a committee meeting, or get in on, but who do you talk to find out what committee and when they meet?
Yeah, exactly.
Well, that's it. You identify the stakeholders, right? Yeah, and you engage them.
Yeah. And so
that's
what we did,
basic tactic.
Yeah, we decided to throw stones from outside the wall, and we got the public health physicians and nurses to sign on to this thing, and then made it a media story. And I think that that's one tactic. And I think in this case, it's surprising to me, especially that when we heard that these other government, the provincial government organizations had made complaints to Health Canada about this, and they'd done nothing. I thought, well, what does it take if your own, counterparts at provincial government are saying, you guys are doing a crappy job and we've got a problem and you have to help us solve it, and they're not doing it.
Well, during the Harper time, that's understandable, but now?
I know. Well, this is not just Harper's legacy. Like this came from the Liberals in '97 with the Alan Rock's original committee.
Oh,
and they Alan Rock was the health minister in 1997. He's from Newfoundland. Was Alan Rock from Newfoundland? I forget where his constituency was. But Alan Rock was the health minister in the late '90s, and in '97 he set up a commission to answer this question about regulation of natural health products and supplements, because they were regulated as foods prior to that, and which was very ineffective because the food laws weren't really made for those kind of products, and so people were getting away with stuff, and the industry kind of went, we need legitimacy, so we want to be regulated, which is funny because now they're arguing we don't want to be regulated.
Yeah.
Like basically,
they found out what that meant.
Yeah, exactly.
Oh, that's what it means.
Yeah, exactly. And that was the problem back in, after, and this is a bit of third-party information, but this is the story we've pieced together about Science Watch, that they demanded this regulation. Alan Rock went, okay, that's a great idea. We'll say that Health Canada has to have this new department that's going to regulate natural health products. We're going to set up the NHPD and then set up a regulatory framework. So I'm not sure if they passed any. They must have passed. I think they must have updated the Food and Drug Act. I know there was regulations passed about natural health products, and I can't recall what the specific legislation was, but they set up the NHPD, and in 2004, 8 years later, or 7 years, 6 years later, they launched the NHPD, and then they discovered that there were 60,000 products, and the framework that they had put together to get approval had failed. They were behind by tens of thousands of products. I don't know how many licenses they had before they went to the pathway to licensing, but it was not very many. And people were frustrated, and they ended up saying, okay, you know what we're going to do? Everyone has a presumptive approval, and then we'll get to your form soon.
Oy.
Right? And that led to, and they set up a science council. The guy who ran it originally, and again, that name is escaping me, was an evidence-based, he came from the scientific community. Like, he was the person you would think should be in charge of a regulatory agency who was testing things for efficacy, quality, and purity, quality and safety. And he tried his best. And they ended up disbanding the Science Advisory Council because basically the Science Advisory Council went, we can't approve any of this. It's ridiculous. The level of evidence is crappy. So they went, okay, that's not rid of you. Yeah, exactly. That's not what we want to hear. So we'll just get rid of you. I guess it's it's got to be a scandal. But no one cared because the only people listening were the people who wanted to get the drugs approved and those who were selling them, and consumers didn't care. Or there was no message. There was nobody sending them the message to care. And so then they came up with this pathway to licensing in 2012 because all they were listening to were the manufacturers who said, we want to get our products to market. And they went, well, how do we get the products to market? Well, we'll do how do we do it safely? Well, we'll do a risk-based assessment. We'll say, you can't say you have a cure to cancer. You can say, we support immune health. And if you do that, then that's a low-risk claim. You can do whatever you want. And then they approved tens of thousands of products. They were just getting these things through like nobody's business. And then they went, monographs, and that's where we've ended up here. Now we've got all these products approved. There's very low quality assurance. The law says you don't have to have quality assurance programs in place. You just have to keep records if you do decide to have quality assurance. Unlike the pharma, industry that has to have quality assurance in place. And then you get these problems with adulteration, contamination, and substitution, which put people at risk.
It's amazing the difference between the two industries. I mean, the
we've come
pharmaceutical
full
industry
circle.
and the natural product industry, totally different rules.
Of
You
course.
know,
Well, you mentioned-
Otherwise, Otherwise, you wouldn't have a health product industry.
Well, you mentioned one had been supplemented with Viagra. How the hell did that happen? Like, how did they get their hands on that without, having to disclose that?
Yeah,
I guess, but
it's done on purpose, right? These things pop up. It's like whack-a-mole. I mean, my understanding is that these products are being imported from someplace else, and the retailers import them, and then when they get caught, they get seized, and there's nothing else they can do. The fines are like the fact that they were left out of Vanessa's law means the fines are laughable. The fines before Vanessa's law were $5,000. It might be per occurrence. I thought it was per day of occurrence. I'm not quite sure, but $5,000. They increased them to $5 million for pharmaceutical companies, but they left the natural health products out of place.
Nice.
Wow.
Right?
Of course.
So,
and these doubles.
Crazy.
Yeah. Well, the thing is, it's come full circle from them being treated as food. Now they're being basically treated as food again. So.
Yeah. Which is the argument that the Canadian Health Food Association is making. They're not drugs. Well, you're using them like drugs. So
you're selling them like they have some
effect.
They're
making health claims.
They're making health claims. I know. It's
legally now. That's even worse. Before they weren't even allowed to make health claims on the bottle.
Yeah.
This is worse.
Yeah. Hopefully the new regulations, I mean, we put in, if people are interested, you can go and see our submission last fall to Health Canada, which identified all these issues, because the new regulations, basically, if they go through, I mean, who knows what they're going to end up being. Some of our advisors are very pessimistic about if there's going to be any change at all. But if they go through, you won't be able to make a claim on the bottle. If you don't have the evidence, you can't make a claim. You can sell, I don't know, Devil's Claw, period. Here's Devil's Claw. Hopefully, there's no quality assurance changes, but, hopefully there's Devil's Claw in it and it's not adulterated with other products or has a substitution. But you can sell the Devil's Claw, but you can't make a claim that it helps your, I don't know, arthritis or whatever that Devil's Claw helps.
Then you're just going back to the way it was. So
yeah, well,
they just put up a website about Devil's Claw without the product name on there and tell you all the wonderful things it's going to do for you.
Exactly, which we think should be illegal as well. And those kind of things. I mean, if a marketer is doing it, here's the real kind of the loophole in the law is that you can hire, like, if I want to sell Devil's Claw to cure cancer, I have no idea it cures cancer, but let's just say it cures cancer, or they think it cures cancer. So you can't say this cures cancer on the label. So you won't get that approved by Health Canada. So on the label you put, supports immune health or some other general health claim, and Health Canada goes, yeah, okay, sure. And you get a naturopath to rubber stamp that, or you find a 10-person open label trial, charitable science basically, to support it, and they approve it.
Anecdote.
Yeah, my mom was cured of cancer by Devil's Claw, so it's perfect. Yeah. So you get that approved, and then what you do is you hire thought leaders in the community to publish articles in all the natural health journals,
chiropractors,
to say Devil's Claw cures cancer. Now they're a third party professional, getting paid by whomever, who knows, to write this article, but it's perfectly legal. And you convince everybody who's prescribing this to prescribe it for cancer, but you don't actually, as a manufacturer, put on the label cancer, and you're perfectly within the law, and it's still complete crap. And
that's how it used to be, and will be again.
Yeah, it's really frustrating.
That used to be is pharmaceutical commercials. These used to be illegal.
Yeah,
on television.
Well, now they come with all those,
and they're very vague.
Well, they're
in Canada they still
vague.
Yeah.
You can only market in Canada. You can only market to physicians who are prescribing.
Yeah,
but
the ones on TV though, 5 minutes of the ad is might do this, might do that, might do this, might do that, might have this side effect. If it does this, go see a doctor right away.
That's American though, right?
It's funny.
Yeah.
It's incredible that it works though. Like if you bookend that with your life will be fantastic, then people forget the middle part and go, oh, my life will be fantastic. I didn't get that little purple pill. Wow, that's a fantastic idea. Like, it's funny how, they do it on purpose because it works. Like, I don't think they'd be spending millions of dollars on this advertising if it didn't work.
Where half of it has to be warnings.
Yeah. And the side effects sound so bloody horrendous. Like, and they just mutter them under their breath. Almost, right?
But you don't have to do that for natural health products.
Nope.
Yeah.
By the way, if there's an effect, there's a side effect.
Yeah, exactly. Yeah, I know. That's another kind of thing we'd like to hit home. I don't understand how they can get away with it. Well, I think that the regulator knows. Like when I spoke to the director general of, or the wasn't the director general. He became the director general, but he was the head of the new pathway, or the pathway to licensing in 2012. And I just forgotten his name. But when I spoke to him at one of the meetings, I said, "Okay, so homeopathy," and he's like, "Yeah, that's a problem." Like, it's a problem. You know you're full of shit, basically. Yep. But you're still doing it. Yeah, well, if all you've got is the homeopathic manufacturers in your office every week saying, when can we get our thing to market? When we get our thing to market, what are you doing blocking our way? Or threatening, access to market.
I was just thinking about these American pharmaceutical commercials. It reminded me of an SNL skit way back.
Oh, right.
Happy Fun Ball. Have you ever seen that one?
Oh yeah, yeah.
Commercial that 2/3 of it is all the side effects of this Happy Fun Ball. It's just a huge long list of side effects.
Meanwhile, what was Happy Fun Ball? Was it a ball, like a rubber ball, or meanwhile, in the background, while they're saying all the side effects, they're playing with the ball happily, like it's the best thing in the world. But
one of the actually funny sketches on Saturday Night Live.
Yeah, that's right.
Hey, the Trump ones have been pretty good lately.
I haven't watched them.
They're so funny. Alec Baldwin is my new hero. I hate the Baldwin brothers, but I like this guy.
But he's the best actor, greatest actor in the world.
When he's doing Trump.
Trump's the best actor?
No. Trump
Baldwin.
hates.
There's a case to be made for that statement, though.
Okay. You have to go on YouTube, Google Alec Baldwin Trump. He does the best Trump impressions. I roll around laughing every single Saturday now. And they always do it as the open. So, and then they're done. And in fact, they were supposed to devote a whole program to it, but I don't. Oh, and then the other funny one is the Putin impersonations now.
Cool.
So,
let's check that out. Yeah.
They've gotten political. And of course, Trump is saying how horrible
they've always
SNL.
been political.
They've always been political. I mean, those are the best
Yeah.
parodies to do because, they're big targets.
Yeah. Well, they actually do a good job impersonating Trump.
Yeah. I remember 1,000 Points of Light from the Bush years when I was a kid. 1,000 Points of Light. It was very funny.
Yeah. Well, I haven't watched it except for the Trump parodies, so.
So again, if people want to get involved in, perhaps wading through tons of data, or some other aspect of Bad Science Watch, how can they get a hold of you?
Great. So they can. You can always, for general inquiries, you can always email us at info@badsciencewatch.ca. But if you want to volunteer, certainly send an email to volunteer.coordinator@badsciencewatch.ca. You can find that a link to that and all the project pages as well at badsciencewatch.ca. And we'd love to hear from people. And certainly you can follow us on Facebook and Twitter. We're at Bad Science Watch and / Bad Science Watch on Facebook. So
and you'll be here in Calgary on Saturday.
I'll be here on Calgary on Saturday. I'm excited. Yeah, I get to make my case again for empathy and get to involve myself in the debate. Apparently, there was quite a debate on the meetup comment section. There was some giant pro alt med, anti alt med kind of debate that erupted, which is not certainly what I want to foster. That's kind of the point. This kind of debate doesn't work. I mean, I don't know.
Well, they're making your point for you.
Yeah, well, exactly. Yeah, I know. I mediated my brother will kill me for talking about this, but I mediated a discussion between his wife and him about vitamins because I had come out of this Fifth Estate program about vitamin supplements and the problems with them. And then there was, Paul Offit was on as well, making his case, which was great.
Yes.
And this came up and I kind of went, look, bro, your wife wants you to be healthy. She wants you to eat a vegetable every once in a while. She doesn't want you to die early of heart disease.
Yeah.
I don't think that vitamins are the answer, but maybe what's coming up is she wanted him to have vitamins. He didn't. He was saying, see, my brother thinks that vitamins are crap. I'm not taking them. I'm like, well, hold on a second. That's not the issue. The issue is she cares about you and you care about her. So how about we answer the real question, which is how to be healthy, instead of getting into this pro-vitamin, anti-vitamin debate. And I didn't handle it very well, but it made me really think about how I would handle it in the future. Because I think identifying, like digging deep about what is the point about these issues, I think is important. I think it helps us build relationships and bring people together to have an actual discussion, instead of forcing us back into our.
Well, then the whole thing there is there's vitamins in vegetables. Eat more vegetables.
Yeah,
exactly. Yeah, balanced diet.
If you're gonna make the whole natural argument, well, get your vitamins naturally.
Eat a vegetable. I know.
Yes.
There's one lesson.
Having said that, I have been told that taking vitamin D, because we don't get that much exposure to sunlight here in Canada, is, that seems to be conventional. Yeah.
Oh, yeah. There's always exceptions. Yeah.
And don't overdose on it.
Yeah.
Don't eat 10 pills a day.
Yeah.
Follow the recommendation.
Talk
Not
to
only
your doctor.
that, I actually did have to have this argument because, my ex got with this girl who wanted me to go and take these very expensive $50 a month vitamins for my kids because the naturopath there had come up with vitamins specifically for them. And that was my argument. They eat vegetables. Until you get me a doctor's note saying they are deficient in these vitamins, I'm not buying them.
Yeah, exactly.
It worked. Shut her up.
Yeah. I know. Yeah, those kind of debates. These are things that these are discussions we have.
No, but I got her off my damn case, and she couldn't call me what did she call me? She called me some monster of a mom or something.
Oh God, that's horrible. I'm so sorry.
Yeah, no kidding.
I'm sorry, that's not going to get me to buy your vitamins from Nutters.
Yeah.
Yeah, take a lesson here. Have some empathy.
Yeah.
Exactly. Yeah.
Nightmare of a mom. That's what she called me.
That's terrible.
I stuffed my
you just
children.
gave yourself the new nickname.
Don't you dare. You better stick with that other one. I mean, wasn't it a homeopath?
Feisty child is in the toilet. It's nightmare of a mom from now
Nightmare
on.
mom.
Yeah.
That was a custody battle that cost me $8,000. Please don't say that.
Well, that makes
I'd
it
wear it with
worth
pride.
the
That's
money, right?
Oh.
Yeah, for sure.
Okay,
It'll be a badge of honor for you. Our audience will believe it.
I don't overdose my children on vitamins, so I'm a nightmare of a mom. Sure, I'll own that.
Oh, my goodness.
Well, Michael, I think we're going to close it. We're over an hour and 15, I guess.
Yeah.
It's evolving here now, too.
And yeah.
Thank you for sticking with us.
Yeah, thanks for being on the Legion of Reason, and we'll hope to see you on Saturday.
Yes, indeed, and thanks for having me, guys.
I'll
This is a
introduce
really enjoyable conversation.
Yeah.
Thank you.
Thank you.